One of the things that we do in my role as Associate Dean for Public Health and Health Policy and Professor of Medicine at the Larner College of Medicine at the University of Vermont is we really believe in educating our medical students in public health so that they see their patients outside of hospital and clinic settings and understand our communities, neighborhoods, and that there are many factors that determine people's health. Part of that, all of our second-year students in groups of 6 or 7 do a community-initiated public health project, and we have 17 projects each fall. We have amazing projects from our students, and I am so incredibly proud of them. One of our students is here today to talk about their project on HPV and cancer prevention. So I'd like to introduce Rachel Madhur, who is a class of 2022, to talk about her public health project. You can use the podium. Yeah, go ahead.
Hi, Dr. Hi, everybody. Thank you, Dr. Carney, for the introduction. I'm going to move this. I'm so excited to be here today to talk to you guys about the important topic of cancer prevention. My name is Rachel Madhur. I am a second-year medical student, almost third-year medical student at the University of Vermont, Larner College of Medicine. And as Dr. Carney explained, as part of our second-year curriculum, we work in small groups on a public health project and partner with community agencies. Our group was lucky enough to get to work with Bill Cousins and Less Cancer, with Dr. Carney as our faculty mentor. Our group decided to explore knowledge gaps regarding human papillomavirus, or HPV, an infection that is responsible for nearly 35,000 cancers annually just within the United States, including cervical, vulvar, vaginal, penile, anal, and oropharyngeal, or head and neck cancer. HPV also has a vaccination that can prevent over 90% of these cancers. But despite this, there's low uptake among US adolescents, and we wanted to know why. Previous research shows that the low uptake is largely due to a lack of knowledge regarding the virus, its consequences, and its preventability. Historically, HPV and its vaccination have been associated with females and sexual activity, and this association is still pervasive today. Many people do not know that HPV can cause cancer, that these cancers can affect both males and females, and that the vaccination can be given to and benefit both males and females. There's even some evidence that healthcare providers are not aware of the association between HPV and non-cervical cancers. Our group specifically wanted to evaluate knowledge gaps in a presumably well-informed and health-conscious population, the followers of Less Cancer. We designed a brief true or false survey and shared it to Less Cancer's website as well as their social media outlets. We also collected demographic information on age, gender, and geographic location. We received surveys from 200 respondents. Of this, almost 3/4 were women, 1/4 were men, and less than 5% were non-binary. 40% were between the ages of 18 to 45, and the rest were over 45 years old. 84% of respondents were within the United States from 38 different states. So what we found is that while 90% correctly answered that HPV can cause genital cancer and that the HPV vaccination can be beneficial for both males and females, only 80% knew that the vaccine is beneficial even after sexual activity. And perhaps most startling, only less than 50% correctly answered yes to HPV can cause head and neck cancers. There was no association between demographics and correct answers. Now, although this was just a pilot study, these results suggest a major knowledge gap. Further highlighting the importance of this, research shows that while cervical cancer rates have plateaued, oropharyngeal cancer rates are increasing. A 2016 study by the Center for Disease Control and Prevention, using population-level data, found that there were more annual cases of HPV-attributed oropharyngeal cancers than cervical cancers annually. Historically, oropharyngeal cancers have been tied to tobacco usage, but the study found that 70% of oropharyngeal cancers were likely attributed, at least in part, to HPV. Now, the vaccine prevents over 90% of HPV cancers, including oropharyngeal. But the CDC 2018 National Immunization Survey showed that only 51% of adolescents ages 13 to 17 have completed their vaccination series. So what do? Our group recommends that it's time to change the dialogue surrounding HPV and the vaccination. Rather than continuing to discuss it in the context of sexual activity or as a sexually transmitted infection, we propose that it is far more effective to focus on the vaccine as a form of primary cancer prevention. And HPV has come up a lot today in many different conversations, and I think more so throughout the day. And that's because it's an easily avoidable and preventable cause of cancer. This is a vaccination that can prevent cancer. And not just cervical and genital cancer, but also cancers of the head and neck. We encourage healthcare providers to emphasize the potential for cancer prevention, particularly oropharyngeal cancer. Research shows that the quality of physician recommendation, including specifically whether or not they discussed cancer prevention, is associated with uptake of the vaccine. We also recommend that education efforts and community organizations, including Less Cancer, place an additional and renewed emphasis on the aspect of cancer prevention and the HPV vaccine. The immune response to the vaccine is stronger the younger it is given, and is more beneficial if given before sexual activity, before there has been any exposure to HPV. So it is crucial to vaccinate adolescents early. And this doesn't mean that adolescents are going to be sexually active as soon as they're vaccinated. It just means that if and when they are sexually active, they will be protected against cancer. According to the latest CDC statistics, there are an average of 44,000 cancers per year in sites that HPV is often found. And of those, almost 80% are caused by HPV. Again, we're talking about nearly 35,000 cancers caused by a virus, and we have a vaccine that can prevent over 90% of them. It's time to change the dialogue around HPV and use the tools that we have to eradicate the tens of thousands of preventable HPV cancers. Thank you.